Hello, in this video, I'm going to talk about brain fog from aromatase inhibitors. Before I go on, I would encourage you to subscribe to our channel. We are always putting out new content, and often because of suggestions that you, our viewers, have made, including this video. I'd also love to invite you to go to yerbba.com to get your personalized Yerbba report. Your Yerbba report will take the information that you give us access to or that you upload to the platform and cross-reference that with the latest medical information. Your report will tell you the types of treatments that might be offered to you when you go see the doctor and the pros and cons. It will also give you a set of questions that you can ask when you go to your medical appointment. So let's talk about aromatase inhibitors and brain fog. If you aren't sure what aromatase inhibitors, we're putting a link to a video you can go and check out. But people on aromatase inhibitors have described problems with forgetfulness, with problems concentrating, with problems finding words. And we know this is a real side effect. This is the thing. Half of the people on aromatase inhibitors get this symptom, but fewer than half of those people tell their doctors. This is a real phenomenon, but people not telling their doctors means that you might hear when you go see the doctor, that's not a side effect of the aromatase inhibitors because they're not hearing it from their patients. So as a physician, I would say, we're sorry, but we need to be told this is a side effect before we actually enter it into how we view a medication. This wasn't really reported in the clinical trials of aromatase inhibitors. Well, what causes this? What causes brain fog with aromatase inhibitors? The most likely cause is that people are having drops in their estrogen, and that estrogen helps cognition. So that's the most common explanation for why there might be concentration or memory problems with the aromatase inhibitors. Your estrogen after menopause is still enough in your body, and on the aromatase inhibitors, it drops to unmeasurable levels. The interesting thing, and this is just an aside, is that cognition after menopause actually in some studies gets better. So it looks like there's a relationship between how much estrogen is in the body, and with the aromatase inhibitors, the extremely low, unmeasurable estrogen levels may contribute to cognitive problems. Who's at risk? Well, the older we get, the more we have problems with cognition in general. We may have more wisdom, but we have a harder time recalling that wisdom. So the older people have a harder time. People who have poor sleep because of hot flashes or because they have other underlying sleep disturbances, many of which get worse on aromatase inhibitors. And the other is if you have other medical problems and you're on other medications, the two together, the aromatase inhibitors and other medications that are common to treat other chronic problems, can make brain fog develop. So you can see there are a lot of things that go into it. When we think about the clinical trials, a lot of people with multiple other medical problems or sleep problems won't go on clinical trials. So that may be one reason this didn't show up in the original and follow-up studies of the aromatase inhibitors. Just, there's a lot of what's called selection bias in who goes on trials, and people may select themselves out of participating as well. So when might cognitive problems develop with aromatase inhibitors? Most of the time it kind of creeps up on you, and we tend to see people describing this between 3 and 6 months. It should go away when you come off the medications if there aren't underlying medical problems causing problems with memory and concentration. So because it's a temporary side effect, it may get better when you come off the medicine, though because with time, these things can become more common. We can't say for sure that it will, but the contribution of the aromatase inhibitor, the contribution from the medication should go away after you come off of the medicine and your estrogen levels return to their postmenopausal level. So how do you handle this? Well, the first thing I think that's really useful is to know that This is a real thing. People worry that there's something wrong with them, and when they're told it's not from the aromatase inhibitor, that can make them not trust themselves. So I just want to validate that this is a real experience people have, and my guess is some of you are already thinking about a comment or a question you might drop below to let us know if this happened to you. But there are a lot of tips and tricks that can really help. One of them is to decrease your cognitive load. So we know that we're more likely to make mistakes with cognition and reasoning and decision making when we're bombarded by lots of things. So one of the things that can be helpful is when you get up in the morning or before you go to bed at night, maybe not right at bedtime, but after dinner, a couple hours before bed, just put everything that's swirling around in your mind. This can help with sleep problems. It can help with anxiety as well. So just do what's called a brain dump. Just dump everything out. You might do this on little pieces of paper, or you might do it on a notebook, or you might do it on a whiteboard. You might even do this on an Etch-a-Sketch. Remember those? Just get everything out you can. Then there's some other things you can do. What is working in your life? So if you always keep your keys in the same area, if you always keep your coat or your phone in the same place and you find that that helps, take that to the next level. So just remember what's working and what's not. So if I never find my keys, something has to change. It's not necessarily something wrong with me. I need to figure out where am I going to put my keys that's easy for me, that's not out of the way. Other tricks like these can be really useful for you. You might make a little reminder to yourself before you go down to the basement. You can record a little voice memo. I'm going to the basement to get a paintbrush, and then you get to the bottom. I know it sounds crazy, but this actually works for people regardless of their problems with memory. This helps with people with ADHD. We have a video on ADHD and how to stay organized. It helps with people who have more severe problems, but make your life easy. The other thing you can do is minimize distraction. You know, a lot of us have something called monkey mind. Our mind's always going, and if we're on a solid train of thought, we get interrupted by what? By our phone, by dings and pings, and we distract ourselves. We actually interrupt ourselves and get on our phones and do something that's a distraction for ourselves. This has been shown in really high-level cognitive jobs that people interrupt themselves. Our whole societies have gotten worse at our attention span, so you're not alone in this, and the aromatase inhibitor may just be making it worse, plus the stress of the diagnosis and stress in relationships and stress in the world for that matter. A lot of people find that exercise helps them get mental clarity, and it's been shown in some studies, although not all, that moderate intensity activity where you can talk but not sing improves your mental function. So that's something to consider if you're not already getting that type of exercise, 4 to 5 times a week. And if you are doing that kind of exercise, you are doing a great job, and it doesn't mean you're not doing enough. And then the last thing is look at the timing of the medication. Some people have reported, and this is anecdotal, it's not been tested in clinical trials, that taking the aromatase inhibitor after breakfast, not first thing in the morning and not at bedtime, can somehow help with the cognitive problems. It's a real side effect. It should go away after you come off the aromatase inhibitors. There may be other contributing factors that you can talk about with your medical team, and I hope that the tips and tricks I've provided are helpful. We'd love to hear how they work out for you. Drop a comment or a question. We get back to you within about 3 weeks, and even if we get back to you quickly, urgent things should go to your medical team and not wait for us. I hope this has been helpful. Thank you for watching, and we'll see you next time.